নমস্কাৰ সকলোকে স্বাগতম জনাইছো নিউজ 18 বিশেষ হলৈ মই প্ৰীতি প্ৰিয়দৰ্শিনী আৰু আজিও আমাৰ হৈতে আছে এগৰাকী বিশেষ ব্যক্তি যাৰ হৈতে আমি বিভিন্ন কথা পাতিম আৰু তেওঁ হৈছে Dr V Balaji Senior Consultant Vascular Surgeon Adjunct Professor Tamil Nadu Dr MGR Medical University. Sir, first of all, welcome to News 18 Assam Northeast.
Thank you for the invitation.
So we will talk about a lot of things related to vascular diseases, but first to start, what are blood vessels and what are their importance? Because we have been reading about blood vessels, but as diseases, what are the diseases that can be happening from blood vessels and what are their importance? That is what we would like to know from you first.
Thank you. As you know, most of the patients don't know much about this specialty called vascular surgery. A lot of patients know about heart attacks, blood vessels in the heart, but they should know that there are blood vessels all over the body. There are two types of blood vessels. One is what we call good blood vessel or artery, which takes the good blood from the heart to other parts of the body, like it can be to the brain, it can be to the hand, it can be to the stomach, it can be to the leg. Similarly, the other blood vessel is what we call a bad blood vessel or vein. This vein takes the blood from different parts of the body back to the heart to mix with the oxygen and come back again. So there are two types of blood vessels. And the diseases, the problems can happen in both the blood vessels, that is arteries and the veins. And these are the diseases, as vascular surgeons, we deal with it. So peripheral vascular surgeons deal with blood vessels diseases of both arteries and veins.
Okay, so talking about the diseases, what are the diseases that can happen due to the blood vessels for both arteries and veins? If you talk about the diseases, sir.
Okay, we'll take it one by one. The common conditions what most of the patients suffer from are from the disease of the veins.
Okay.
Again, in the veins, we have two different problems we see commonly. One which is very, very common is what is called varicose veins. Lot of patients see the veins in the leg which becomes very big, which is very prominent in the leg, especially women. During pregnancy, after pregnancy, they see these veins standing out in the leg. They are called varicose veins. Again, in varicose veins, they are of different types, of different stages. And all these varicose veins, over a period of time, can get bigger and bigger and bigger. Over a period of years, they can develop complications. The commonest complications initially will be swelling, pain, and later, after many years, it can damage the skin to form what's called eczema, that is ulcerations. Sometimes the vein becomes so big, it can even burst, cause extensive bleeding. So these are the different types of complications of varicose veins.
So why do you think, why should we create awareness? So when we talk about awareness, why should we create awareness about vascular diseases? Why is it so important to create awareness?
As both vein disease as well as artery disease are very, very important, they can affect the patient in different forms. Veins, commonly varicose veins, as it is very, very common, it comes in the way of normal day-to-day problems. For example, patients having, especially people who are working, when they're standing for a long time, it can cause a lot of swelling, a lot of pain, skin disorders, and bleeding. So they have to see the doctor immediately as soon as this problem arises. Similarly, the other common problem, what we see now, it's called a block in the veins, what is called a deep vein thrombosis. And this can turn out to be a major killer disease. What patients can lose their life because of this thrombosis. So they should also contact the specialist immediately as soon as they see any symptoms and signs of thrombosis, which is mainly swelling and pain. The next is disease of the arteries, which is very, very important. Patients, especially elderly age group, develops problem in the arteries, that is thickening of the blood vessels, what is called a peripheral vascular disease. As the patient becomes older, especially because of diabetes, blood pressure, cholesterol, also if the patient has to be a smoker, the disease affects all the blood vessels in the body. So this can affect blood circulation to the various organs affecting the body. So they should seek the specialist advice immediately so that they don't suffer from complications.
Okay, so talking about the causes, thrombosis, as you have said about the blockage, what can be the causes? What are the causes for thrombosis? Because it can also be can it be a lifestyle issue as well? Like the lifestyle impacts and becomes a disease. Can that be a possibility?
Yes, venous thrombosis or deep vein thrombosis affecting the veins can appear suddenly, what is called acute deep vein thrombosis.
Okay.
This can be usually a complication of what is called immobilization. That is, patients don't walk or they lie down or becoming sedentary for a long period of time. This typically happens when the patient gets admitted to the hospital for any illness. Commonly, in elderly patients getting admitted for an orthopedic procedure like bone-related surgeries, fracture, hip replacement, knee replacement. So many diseases which makes a patient immobile for few days. It may be 2 days, 3 days, 4 days. And suddenly patient develops a clot in the leg. Similarly, patient can have any critical medical illness. It can even be a severe abdominal pain or gastroenteritis in an elderly age group can precipitate deep vein thrombosis.
Okay.
Commonly, the deep vein thrombosis can happen because of pregnancy also, what is called post-pregnancy thrombosis. So that is why young ladies have to be very, very careful immediately after delivery. It can be a normal delivery or even after a cesarean section. They should get up and walk as quickly as possible. We advise mobilization as soon as possible so that patients don't develop thrombosis in the leg.
Okay. So along with that, we have to talk about peripheral vascular diseases. Which group of patients, if we talk about the group of patients of the population at risk of developing, we can say peripheral vascular diseases, which group of patients?
I think this is a very, very important question to create awareness among the patients because this is becoming commoner and commoner. It used to be a disease of the Western population. Now, because our lifestyle has changed, our population is growing older and older. We see a lot of elderly population in our society also. Also, smoking has become very common in our society. So, the risk factors are age, smoking, diabetes. As you know, in India, diabetes is very, very common. I mean, as far as statistics goes, nearly about 20-25% of the population or adult population suffer from diabetes. And longer you are a diabetic, higher chance of developing peripheral vascular disease. Also, patients have what is called a familial disease. They can have familial dyslipidemia or cholesterol problems, which affects young age patients. So, these are the high-risk population who can develop vascular disease. So, if these patients develop complaint, they should see a physician immediately so that if you pick it up early, treatment becomes early so that they can go back to their original lifestyle normally.
Speaking about getting it early, what are the symptoms of peripheral vascular diseases? Because once they detect the symptoms, then they can get aware that they are suffering from peripheral vascular diseases. So what are the symptoms?
Again, this is very, very important for everybody to know how to pick up these symptoms early. Just an example, if somebody has a problem with the leg, for example, the blood vessel going to the blood vessel, leg is blocked, obviously when you walk, the muscles don't get enough blood supply, so they get leg pain. Pretty much like how patients develop a heart attack or heart pain when there is a block in the heart blood vessel. So, when the patient starts walking, he develops pain in the leg. Again, this should not be confused with other leg pains. Like it can be due to arthritis, it can be due to bone pains, it can be due to rheumatism. There are so many other causes. Typically, the pain happens when the patient starts walking. A lot of patients or a lot of people go for walking every day. And when they develop this disease, they cannot go for a walk like before. Especially diabetic patients who do walking every day, when the walking distance starts coming down, I think they should suspect a peripheral vascular disease because the peripheral vascular disease is very, very common in long-term diabetics, especially other risk factors. So they should seek the opinion of the physician immediately. And the diagnosis becomes very easy because we can easily do what is called a Doppler test, which picks up this kind of problems very, very early. So treatment becomes very easy for them.
Okay, so how do they differentiate between the leg pain due to different other issues, other causes, and peripheral vascular diseases? How do they differentiate between that pain in the leg that you have cited about?
The leg pains are very common in a lot of people, a lot of patients, especially in elderly group of patients. So it's very important for the patient to know which one is serious, which one is not so serious. In vascular diseases predominantly, this is the pain which happens along the muscles.
Okay.
Because the blood goes to the muscles and when you start walking, muscle has to be active. So it requires more blood than when you are sitting down. So when the muscle requires more blood, which the blood vessels cannot give, the patient reduces the walking distance. So much so, over a period of time, he cannot walk at all. Then what we call, it becomes a rest pain. That is, even at resting, patients develop pain. And the next stage, patient cannot sleep at all because the pain becomes very continuous.
Okay.
So that becomes a very, very, very serious and late stage. So it becomes an emergency. The patient has to go to a hospital immediately then. Otherwise, he's got a high chance of losing the leg.
So we can say that the sleep also gets reduced due to the pain. It becomes that severe of a pain, right?
Correct.
Okay. The pain in the leg that you are saying about can get very, very severe, and it can even reduce the sleep of the person, of the patient. Also talking about it, how can we confirm about a peripheral vascular disease easily?
See, these days, the diagnostic techniques are available easily everywhere. For confirmation of peripheral vascular disease, we have what's called a Doppler test. The Doppler test is nothing but ultrasound machines, which I think patients are very well used to because over a period of years they would have had ultrasound for the abdomen, or men go for the prostate ultrasound and everything. Women go for ultrasound of the babies when they are pregnant and things like that. Same ultrasound can be used in the leg to detect the poor flows in the blood vessels. So this is an external test, no injection required, no pain, and easily available in most of the tier 2, tier 3 cities also these days. So diagnosis can be made very easily and quickly if the patient goes to a doctor quickly.
So as easily it is treated, there can be more chances of getting it cured, right? And early symptoms obviously can help in the treatment. Is it like that?
Very good. Yes. Earlier the diagnosis, your technique of treatment becomes easier and the results are very good. Longer you wait, the disease becomes very complex. So patients will require very complex treatment and the success rate is not going to be 100%. So our aim of treatment should be saving the leg and saving the life. So if the patient comes to a doctor or a specialist quickly, we can pick it up early. Because these days, we have excellent treatment in the form of what is called endovascular therapy. That is how patients undergo angioplasty and stenting for the heart, we can do angioplasty for the leg also. So it is just a day or two of stay in the hospital without any cutting, without any suture, without any blood loss. So patient can go back to the work within 2-3 days or so. So this all can happen only if the patient gets detected very early in the disease.
Also about the patients, how do you think they can take care of themselves? Like those patients who are maybe watching the show and they are thinking that what if they could have taken some kind of care for themselves? How can they take care of themselves if they are suffering from peripheral vascular diseases?
Very good question again, because there are a lot of patients at risk. There are patients in the community who are not at a low risk. There are patients in the community who are at high risk. For example, we discussed this disease is very common in elderly, diabetics, smokers, blood pressure problem, cholesterol problems. And these patients, when they develop symptoms, especially heavy smoking, uncontrolled diabetes, very high cholesterol, these patients develop disease very quickly. The blood vessels becomes very hard, very narrow, very quickly, very young age. So you don't have to be very old if you are a heavy smoker or a long diabetic. So the moment you come under the risk category and you have symptoms, what we have been discussing, like leg pain on walking, I think a test is mandatory so that the diagnosis is made very clearly and easily.
How can we prevent it? If we talk about the prevention before having such kind of diseases, what can lead to such kind of diseases we have talked, but how can we prevent from such kind of, prevent ourselves from falling into this category? Obviously, we are talking about the treatments, but we always say that prevention is better than cure. So how do you think a patient can prevent himself or herself from falling into peripheral vascular diseases?
I think this should be a good message. Through this program to a lot of people out there. Obviously, as you rightly said, prevention is better than cure because treatment is going to be expensive and long-term complications are going to be there. So, if the patient falls under risk group, they should immediately, for example, if you are a smoker, you should stop smoking. If you are a diabetic, the control should be very good. See the doctor frequently, make sure your diabetes control is very good, your diet control, very importantly, your lifestyle. If you are overweight, try to lose weight by diet control and exercise. And if you have other diseases, you should practice walking every day. This not only increases the circulation in the leg, losing weight, also if you have any development of symptoms, you can pick it up very early. The commonest problems what we see now these days is shifting group of patients from elderly group to younger age group, mainly because of sedentary lifestyle.
চাবি যেতিয়ালৈকে ধূপ জ্বলিব বেটছমেনে খেলিব
দেউতা দীঘল কিবা এটা জ্বলোৱা না তেওঁ আৰু দেৰিলৈকে খেলিব
লিয়া দীঘল ধূপকাঠি
Talking about Western food, does food have any implications, like because what kind of food can maybe cause more of such kind of diseases? Because food is a very important part of our lives, and mostly the younger generation has to end up with some kind of fast food every day. So most of the diseases have such kind of causes, like food becomes a major cause. So do you think food can may be a cause for peripheral vascular disease?
Again, very rightly as you said, food is one of the important factor which is causing a shift in the disease pattern in our country. As the Western food has arrived in our country also, we are not telling people should not have it, but frequent consumption of high calorie, high fatty, high salt food certainly will cause overweight, obesity and obesity related complications, as well as increase in the blood pressure, hypertension and fat content, dyslipidemia, cholesterol problems, which leads on later to a lot of vascular complication, not only to peripheral vascular disease, it can lead on to cardiac disease, it can lead on to cerebrovascular disease, what we call a stroke problem and everything. Again, when compared to 20 years ago to today, there are a lot of cutting edge technologies which is available in our country, especially our centers do a lot of procedures. Olden days, only open procedure was only available to patients with vascular disease, both venous problems as well as arterial problems. Now, for example, for varicose veins, this is 100% of the patients now undergo only what is called endovenous procedures. It is only a daycare procedures. That is, patients don't even get admitted to the hospital. They come, stay for only about 4 hours, get the procedure done, and then they can walk back. In fact, they can even go back to work next day, depending on what type of work they do. So this is almost become what's called an office-based procedure, and it's very convenient for the patients also if they have varicose veins. Again, for arterial disease, when they have arterial blockages, nearly 85% of the patients are suitable for endovascular procedures. So again, open surgeries can be avoided. So that their stay in the hospital is minimized. So getting back to work is also very, very easy for them. Also, we see a lot of patients with now in the elderly group with uncontrolled hypertension with what is called aortic aneurysm, which used to involve very major life-threatening procedures before. Now, because of endovascular procedures, what is called endovascular aneurysm repairs, both TVAS and EVAS, made the procedure very, very simple. Again, the hospital stay, which used to be 15 days before, has come down to 2 days with the available of newer technologies, and also has become very safe with the complication less than 1%. So there are a lot of technological advancement which has happened in our vascular surgery also, which made life very, very easy for patients with vascular diseases, which is available in most of the big centers in the country now.
Okay, also talking about an advice that you would like to give to the patients who are at risk. What kind of advice would you like to give to those patients who are at risk of peripheral vascular diseases?
As a message, I can say that people who are at risk or people who do not have disease, they should watch for a disease. They should prevent the disease. If you have any diseases, for example, diabetes, see your diabetologist, specialist frequently, control your sugars, make sure it's well within the limits, acceptable limits. If you have blood pressure, again, diet restriction, salt restriction, consuming the tablets regularly, make sure your blood pressure is under control. If you have cholesterol problems, again, exercise to control the cholesterol levels, taking medications regularly so that you don't land up in complications. If you have habits like consuming tobacco in any form, it can be smoking, it can be chewing, it can be sniffing, any tobacco can affect the blood vessels. So if you have that habit, you should stop immediately, not just reduction, just stop immediately. And if you have developed any symptoms, do not postpone the visit to a doctor. So you have to see the doctor immediately so that your diagnosis is made very early. Treatment becomes very simple with good results.
We are talking about the late stage. If we can know more about that, so that people become more aware, what happens when they will reach the last stage, so that they get it tracked early and seek the doctor earlier. So what can the last stage look like in certain complicated diseases that you have stated about?
Predominantly the vascular disease, the peripheral vascular disease, gives enough symptoms earlier on, like we discussed about pain on walking in the leg. If they ignore, we said about pain continuous in the leg. If they ignore that stage, the colors in the foot starts changing.
Okay.
To begin with, it may be blue and then it's black. That's the stage what we call gangrenous changes.
Okay.
That's a stage where they have a high chance of losing the leg if they don't seek the medical attention urgently. Urgently means we're talking about within days. So it becomes like an emergency admission to hospital or going to a higher specialized center. And those are the stages. If they ignore, nothing we can do other than removing the leg, what is called amputation. So that is what we don't want patients to go through. That is what we want to avoid. So if the patients know all the symptoms, to pick it up early, they should see a specialist immediately.
Thank you so much. Aru tekhetor hoite ami aji bibhinno kotha patilu aru kene dhorone peripheral vascular disease ba bemar homo hobo pare he kotha ami aji alochona korilu, but lastly also, although I asked you for the last comment, we'll have to talk about the awareness, the way we are speaking to our audience who are our patients. So maybe some of them are going through such kind of diseases. How do you think we can make them more aware? Obviously TV shows like this will work, but from the doctor's part of view, how do you think more awareness can be done? Because most people will definitely think that the pain in the limbs might not be a part of the vascular diseases. Maybe I myself would not have thought like that. So if they are not aware of it, maybe it will be traced later, which will bring them danger. So what do you think can be done for awareness?
Now, as a society, we as a Vascular Society of India, we create awareness. We have what's called a Vascular Awareness Week in the month of April. We run programs throughout the country, throughout the year. Our website is open with the symptoms and signs of all the problems. People are interested can look into it. And most of the vascular surgeons around the country, they have been creating awareness in locally, whichever state they are from. So information is available on the web, and there are a lot of specialists around the country who are happy to help you if you have any symptoms. So you seek the advice of the specialist immediately, and be on the guard. If you are in a high risk group, if you have any symptoms, seek the doctor's opinion immediately. Don't ignore.
How can they contact you? Like if there are patients from this part of the country suffering through such kind of diseases, how can they contact you? A little bit about your contact.
We have centers in in Guwahati and various parts of Assam here, and people have symptoms, they can contact our office. We specialists visit our centers from our center every 3 months or so, so patients can visit physically. There are a lot of virtual appointments available, which our centers will be more than happy to support. So there are different ways of doing it, and we are just a phone call away from anybody. If they have any doubts, they want to see a specialist, if you want any information, we are here to help you. So if you have any problem, please contact us. Don't ignore your symptoms.
Can they also consult you in every 3 months? Like, do you visit here in Guwahati? Is it like that?
Yes, I've been doing this for the last 24 years.
Okay.
We're visiting Guwahati, so various parts of the Northeast. So I'm available physically as well as virtually, wherever you are. So it's easy to contact. So that should not be a problem if you have any symptoms and signs of vascular disease.
গতিকে দৰ্শকসকল আমি আজি বিভিন্ন কথা পাতিলো এই ৰোগৰ লগত জড়িত বিভিন্ন কথা পাতিলো কেনে ধৰণে সেই ৰোগৰ হুনকালে আপুনি সেই ৰোগৰ কথা গম পাব পাৰে আৰু হুনকালে চিকিৎসালয়লৈ যাব পাৰে যাতে সেই ৰোগৰ চিকিৎসালয় অতি হুনকালে সেই ৰোগৰ পৰা নিৰাময় হ'ব পাৰে ৰোগ নিৰাময় কৰিব পাৰে কাৰণ বিভিন্ন সিম্পটমছৰ কথা আমি আজি পাতিলো ভৰিত বিষ অনুভৱ কৰিব পাৰে বিভিন্ন লাইফষ্টাইল জড়িত কাৰণৰ বাবে এনেবোৰ ভাস্কুলাৰ প্ৰবলেম ভাস্কুলাৰ ডিজিজেস হ'ব পাৰে যদি আমি বেছি সময় কম্পিউটাৰত বহি থাকো বেছি মুভমেন্ট নহয় ভৰিৰ বিষ অনুভৱ কৰে তেতিয়াও এটা ধাৰণা কৰিব পাৰে যে এনে ধৰণৰ অসুখত আপুনি ভুগিব পাৰে গতিকে যিমান হুনকালে সেই বেমাৰৰ বাবে চিকিৎসালয়লৈ যায় চিকিৎসকক দেখুৱায় হিমান হুনকালে সেই ৰোগৰ পৰা পৰিত্ৰাণ পোৱাৰ আপুনি সম্ভাৱনা আছে কাৰণ যেতিয়াই বেছি হৈ যায় তেতিয়াই সেই বেমাৰটো বেছি গভীৰ হৈ যায় গুৰুতৰ হৈ যায় আৰু তেতিয়াই বেছি টকা খৰচ কৰি চিকিৎসা কৰিবলগীয়া হয় আৰু তাৰ লগতে সেই গম্ভীৰতা বৃদ্ধি পোৱাৰ বাবে তাৰ পৰা নিৰাময় হোৱাৰ সেই ৰোগ নিৰাময় হোৱাৰো চান্সেছ বিলাক কমি যায় গতিকে আমি বিভিন্ন কথা পাতিলো তেখেতলোকৰ হৈতেও আপোনালোকে যোগাযোগ কৰিব পাৰিব তেখেত আহে 3 মাহৰ মূৰে মূৰে তেখেত ইয়ালৈ আহে যোগাযোগৰ সকলো কথা আমি আপোনালোকক জনালো আৰু কেনে ধৰণে এই ৰোগৰ কথা গম পাই এই ৰোগৰ পৰা পৰিত্ৰাণ পাব পাৰে সেই সকলোবোৰ বিষয় আজিৰ এই শিতানত আমি আলোচনা কৰিবলৈ চেষ্টা কৰিলো আৰু তেখেতৰ পৰা বিভিন্ন কথা জানিলো যি কথা নিশ্চিতভাৱে আপোনালোকক এনে ধৰণৰ যিবোৰ ভাস্কুলাৰ ডিজিজেস ভাস্কুলাৰ বেমাৰৰ পৰা আপোনাক ৰক্ষা কৰিব পাৰে গতিকে আজিলৈ এই অনুষ্ঠানৰ পৰা সামৰণি মাৰিছো নমস্কাৰ